The phrase "end homelessness" is used often. It appears in speeches, it appears in mission statements, it appears in strategic plans. But without definition, it risks becoming only an aspiration. We must acknowledge this at the outset. It is not possible to prevent every single episode of homelessness. Housing instability will always occur. It has throughout recorded history. Jobs will be lost, rents will rise, conflicts will end relationships, health will fail. These realities are part of human life. What is possible, and what must be our focus, is to end chronic homelessness. The sustained long-term absence of stable housing. The form of homelessness most damaging to health, to dignity, to life itself. The most expensive type of homelessness to respond to. Chronic homelessness is not inevitable. It exists because systems and policies allow it to exist. If we can create the conditions for it, we can remove those conditions. This is not conjecture. These conclusions are drawn from decades of research, rigorous evaluation, and lived practice in the sector. They reflect evidence gathered from multiple countries, thousands of programs, and long-term tracking of community outcomes. They are reinforced by consistent findings across academic studies, government reports, and field-based evaluations. The result of that accumulated knowledge is clear. It requires 10 essential ingredients to end homelessness. All of them working together without compromise. If even one is missing, the effort will fail. Progress requires leadership that is visible, leadership that is active, leadership that takes responsibility for results. Leadership is, at its core, influence, the ability to inspire action, align stakeholders, and sustain momentum over time. To galvanize a community around the singular aim of ending chronic homelessness, leadership must be both consistent and influential. Consistent leadership ensures stability of vision and approach, even as political cycles, funding pressures, and public opinion shift. Influential leadership mobilizes diverse partners, things like government agencies, nonprofits, landlords, healthcare providers, and the public, to work towards a shared outcome rather than competing priorities. This must be paired with accountability, clear lines of responsibility for measurable outcomes. If no one is clearly accountable, if leadership is diffuse, if authority is scattered, efforts stall. In communities that have made real progress, leaders have been identifiable, they have been answerable, they have accepted both recognition and criticism. Leadership defines direction. Accountability sustains it. Influence makes it possible to move the entire system towards that goal. You cannot solve what you cannot measure. Accurate, timely, shared data is the foundation of effective strategy, and it is not just for researchers or evaluators. Frontline workers, program managers, policymakers, and funders all require reliable data to make daily operational decisions, adjust interventions, and measure progress towards ending chronic homelessness. This means a single agreed-upon understanding of who is homeless, how long they have been homeless, and why they have become homeless. It also means that every service provider in the homelessness response system must use the same coordinated data system. When different agencies operate separate databases or track only their clients, the community loses the ability to see the full picture and respond as a unified system. For data to be actionable, it must be accurate and timely. Things like outdated counts, incomplete client records, or inconsistent definitions lead to flawed planning and wasted resources. With accurate and current data, planning becomes precise. Resources can become targeted effectively, and the impact of interventions can be measured and improved in real time. Without this, resources are misdirected, beds can sit empty while people remain outside, and funding flows to programs that do not address the actual need. Fragmentation weakens results. When agencies operate in isolation, each with its own philosophy, service model, and priorities, the system as a whole loses coherence. Clients are shuffled between programs with different rules and expectations. Service providers compete for resources instead of aligning them. And policymakers struggle to evaluate progress because the outcomes are inconsistent and incomparable. Every agency and policymaker must align on the following: service models that define how people are engaged, assessed, and supported, program standards that ensure a minimum level of quality and consistency across providers, evidence-informed practices that have been tested, evaluated, and shown to produce measurable improvements in housing stability. Without this alignment, contradictions are inevitable. One agency moves a person rapidly into housing, believing that stability comes from permanent housing first, and another requires extended stays in shelter to prepare for housing, delaying access for months. Another still focuses narrowly on employment readiness, leaving housing stability as a secondary concern. The result is predictable: delays, confusion, duplication of effort, and wasted resources. Worse, people experiencing homelessness are left to navigate a maze of conflicting approaches at a time when their capacity to manage complexity is already stretched thin. Agreement does not mean uniformity for its own sake. And it's not about stripping out creativity or ignoring the needs of specific populations. Instead, agreement creates a shared framework that gives the system stability and predictability while leaving room for innovation within that framework. When a community commits to a common approach, things like data become more comparable and actionable. Resources can be pooled and targeted strategically. People move more quickly through the system because the rules and expectations are clear and consistent. Promising practices can be replicated across multiple providers, scaling their impact. Within this kind of shared framework, innovation is not stifled. It is channeled towards solving shared problems and improving outcomes for the entire community. Outside that framework, innovation becomes inconsistency, and inconsistency erodes trust, wastes time, and costs lives. Homelessness is not resolved by goodwill alone. It requires professionals with the right competencies and the capacity to apply them consistently. This includes engaging landlords and property managers to expand access to available units. And it includes understanding tenancy laws and rights to protect housing stability. And it includes preventing eviction through early conflict resolution and mediation. And it includes delivering trauma-informed care that recognizes and responds to the impact of past experiences. And it includes navigating health, justice, and social systems to coordinate comprehensive support. And it includes applying motivational interviewing to build trust, strengthen commitment to change, and support self-directed goals. And finally, it includes using progressive engagement to tailor the intensity of services over time, starting with the least intrusive supports and increasing only as needed. All of these interactions need to be grounded in a person-centered and strength-based approach that focuses on capabilities, resilience, and choice rather than deficits. Without these skills, even the most well-designed policies will fail at the point of delivery. Professionalism has to be sustained, and we sustain this through ongoing training and skills development. We sustain it through adequate staffing ratios to allow meaningful engagement. We sustain it through organizational support to prevent burnout and reduce turnover. The workforce is the system's operational capacity. Without it, the system cannot function at scale, and progress will not be sustained. Those who have experienced homelessness bring insights no data set can fully capture. They know the barriers because they've faced them repeatedly. They know the inefficiencies because they've navigated systems that are supposed to help, but often make the journey harder. They know the unintended harms because they've lived through the consequences of decisions made without their input. The inclusion of people with lived and living experience must be structured and consistent, not sporadic or symbolic. It has to extend to representation in decision-making bodies with full voting rights and influence on policy direction, involvement in program design so the services reflect real-world needs rather than assumptions, engagement and evaluation ensuring that measures of success reflect what truly matters to the people served. This engagement must go beyond simply asking for feedback or inviting someone to a single meeting. It means building ongoing roles for lived experience leaders at all levels of the system, from governance to frontline program advisory. Tokenism, including someone for appearances rather than genuine influence, can be worse than no inclusion at all, because it creates the illusion of representation while leaving the underlying blind spots intact. When lived experience is integrated meaningfully, systems become more accessible, more humane, and more effective. Without it, blind spots become embedded into the very design of the system, and those gaps perpetuate the very problems we aim to solve. Homelessness is not experienced the same way by all people. An Indigenous elder, a young person aging out of care, a newcomer family, a woman fleeing violence, a senior with limited mobility, a Black or brown man or woman navigating both the challenges of homelessness and the weight of systemic racism. The barriers they face, they're not interchangeable. Race, culture, age, gender identity, and sexual orientation all shape how homelessness is experienced and how the system needs to respond. The experiences of a middle-aged Caucasian, cisgender, straight man is fundamentally different from that of a racialized woman or transgender youth or an Indigenous elder. Differences in discrimination, access to services, safety, and trust in institutions profoundly influence outcomes. Cultural safety builds trust where history has created mistrust. Age-appropriate services ensure physical access, relevance, and effectiveness. Gender-appropriate services protect dignity and safety, and anti-racist practices must be embedded at every level to address inequities experienced by Black, brown, Indigenous, and other people of color. A system designed for the average person will fail most people and will perpetuate disparities unless it actively addresses them. Homelessness intersects with many systems: healthcare, mental health, addictions, child welfare, corrections, income support, and so on. When these systems operate in isolation, hospitals discharge people to the street, prisons release people without housing, youth leave care without a stable home. But strong leadership within the homelessness response system can build connections across these systems and sustain them over time. Those relationships do not form automatically. They require intentional outreach, consistent engagement, and a willingness to bridge different mandates, priorities, and cultures. Other systems, they don't always share the same mission or primary focus. Think of healthcare. Healthcare is focused on patient outcomes. Justice systems are focused on public safety. Child welfare is focused on protecting vulnerable children. Yet, when homelessness is not addressed, it makes the work within each of those systems more difficult, more expensive, and less effective. Patients discharged into homelessness are more likely to be readmitted. Individuals leaving prison without housing are more likely to reoffend. And youth without stable housing are more likely to return to state care or become involved in justice systems. The homelessness response system is often woefully under-resourced compared to these larger systems. Influence, therefore, is rarely economic. We cannot buy cooperation with funding parity. Instead, influence comes from making a clear, evidence-based case that ending homelessness will help other systems achieve their own goals reduce strain on their resources, and improve their core outcomes. Collaboration requires certain things. Shared objectives that recognize the mutual benefits of housing stability, data integration where possible to track outcomes across systems, things like coordinated outreach and discharge planning to prevent people from entering homelessness directly from institutions, shared accountability for results so no system can simply pass responsibility to another. Without this kind of leadership-driven, intentional collaboration, people will continue to fall into the gaps between systems, and homelessness will grow in those gaps. What is public trust built on? Well, I happen to think it's built on transparency. Communities have to be able to report openly and regularly on progress, barriers, and adjustments to strategy. Those communications have to be clear, data-driven, and accessible. It's not enough to rely on mainstream or traditional media to convey these messages. Why? Well, mainstream media outlets have their own editorial priorities, their own time constraints, and their own framing choices, which can distort or overly simplify complex realities. Effective communication means owning both the narrative and the vehicle for sharing it. That means creating direct channels, websites, dashboards, community forums, social media platforms, newsletters, where accurate information is presented consistently without being filtered through third parties. When you control both the content and the delivery, you can ensure that progress is recognized, challenges are explained, and misinformation is countered before it takes hold. If the public only hears of failures, support erodes. If the public only hears of successes, the remaining challenges are underestimated. Balanced transparency builds credibility, and credibility sustains momentum. A plan without performance management is static. Performance management makes it dynamic and adaptive and accountable. It's not just about tracking numbers. It's about using those numbers to drive decision-making every single day. It means things like setting measurable targets that are ambitious yet achievable, monitoring outcomes in real time, not months after the fact, making adjustments based on evidence, not opinion or habit. Performance management requires the discipline to stop what does not work, even if it's familiar, and to expand what does, even if it challenges the status quo. When systems do not manage performance, they drift towards tradition over effectiveness. Programs continue because we've always done it this way, regardless of results. Resources remain locked in outdated approaches while promising innovations struggle to gain traction. In contrast, communities that embed performance management into their culture, they make continuous improvement the norm. They treat every intervention as a hypothesis to be tested, refined, and scaled if proven effective. What else do? They engage staff, they engage partners, they engage interested and affected parties in reviewing results and identifying solutions. Performance management is not about blame. It's about learning. It's about adapting. And it's about relentlessly pursuing better outcomes. Without it, ending chronic homelessness remains a statement of intent rather than a measurable reality. This is the critical enabler, the foundation without which the other 9 ingredients cannot succeed. Without sustained funding at the scale of the need, the system cannot operate effectively. Without sufficient housing in the right locations, at the right affordability levels, housing access cannot occur, no matter how well the rest of the system functions. Adequate funding requires political commitment that matches resources to reality, not just to what is politically convenient or publicly palatable. It means multi-year funding commitments so programs can plan ahead, retain skilled staff, and build the infrastructure necessary to support long-term change. Adequate housing supply requires strategic investment in things like new construction targeted to the lowest income households, targeted such that we see acquisition of existing units bringing them back into the affordable housing stock. Things like preservation of affordable housing so it's not lost to market pressures. Things like partnerships with private landlords to open doors quickly and sustain tenancies. When funding is inadequate or housing is unavailable, every other intervention is slowed, reduced in scale, or stopped entirely. People remain in shelters far longer than necessary. Outreach workers spend more time searching for vacancies than securing housing. And the overall cost to the community in healthcare, justice involvement, and human suffering grows. Without both funding and housing, the rest is just theory. With them, the other 9 ingredients have the power to deliver results. Ending chronic homelessness is possible. It requires these 10 ingredients. Leadership and accountability to drive action. Data to inform every decision. Agreement on approaches to align the system. Skilled professionals to deliver results. Lived experience to keep the system grounded in reality. Culturally, age, and gender appropriate services to ensure inclusion. Cross-system collaboration to close the gaps. Transparent communication to build trust. Performance management to keep the system adaptive. And adequate funding and housing to make it all possible. These are not optional. They are interdependent. Remove one, and the system falters. Include all, and chronic homelessness can be made rare, brief, and non-recurring. The question is no longer whether we know what works. We know what works. The question is whether we will commit to doing all of it, fully, consistently, and without compromise. If you've made it this far, you've heard the 10 essential ingredients. Now, I want to hear from you. Which of these ingredients do you see working well in your community? Which ones are missing? And if you could change just one thing tomorrow to move closer to ending chronic homelessness, what would it be? Share your thoughts in the comments below. Make sure that you keep the conversation going because it matters as much as the plan. And if you found this helpful, consider liking this video and subscribing to the channel. It helps keep these conversations going, and it helps more people see that ending chronic homelessness is not only necessary, it's possible. Thanks for watching.